Sir, it's time, sir. Shall we begin, sir? Sorry, sir, I couldn't hear you.
Yeah, we can start, Shravani.
Okay, sir. Thank you, sir.
To quote Nelson Mandela, the greatest glory in living lies not in never failing, but in rising every time we fall. Good evening, everyone. Welcome to SAMSIDDHI 2021 International Web Conference Series conducted by Ayurveda College Coimbatore, powered by DIKSHA E-Learning. Today, we have the great opportunity of attending the session of great doctors, Dr. Suhas Kumar Shetty and Dr. Prasandra Kumar Sarkar.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class sessions, use laptop with a high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be posted in the chat box. Question stays will be cleared at the end of the session.
Now, to render the welcome address, I would like to invite Dr. Needu, Assistant Professor, Department of Kai Chikitsa, Ayurveda College, Coimbatore. Over to you, ma'am.
Thank you. My humble pranams to the gathering. It's my privilege to extend a cheerful welcome to you all for the SAMSIDDHI 2021 organized by Ayurveda College Coimbatore and DIKSHA E-Learning. As you all know, the topic for today's session is Concept of Sattvavajaya Chikitsa in the Present Era by Dr. Suhas Kumar Shetty, sir, Professor and Head of Department of Manovijnana Eva Mansaroga and of SDM Ayurveda College and Hospital Hassan. I extend a warm word of welcome to you, sir, for accepting our invitation and for being with us here today. Hope your valuable experience and views on vast clinical area will be enlightening to all of us. We are all delighted to listen to your words, sir. And on behalf of Ayurveda College Coimbatore, I once again welcome you all delegates to today's session. Thank you. Thank you, sir.
Thank you, ma'am.
Today's first session, we will be discussing about concept of Sattvavajaya Chikitsa in Present Era by Dr. Suhas Kumar Shetty. It's my great pleasure to introduce the guest speaker. Dr. Suhas Kumar Shetty, MD Ayurveda, PhD, is an Ayurveda practitioner, teacher, and researcher who is specialized in mental health research, methodology, and medical statistics with experience of over 16 years. Currently, holding a post of Professor and Head of Department of Manovijnana Eva Manasaroga, Ayurveda Psychiatry, and Dean at STM College of Ayurveda and Hospital, Hassan, India. He is also an adjunct faculty at Southern California University of Health Science, California, USA, and a certified NABH Ayush assessor. He is an international invited speaker in various conferences and workshops across the globe and attracts health seekers from USA, England, Scotland, South Africa, Sri Lanka, and various parts of India. He is an editorial and review board of many scientific journals. He has credited 3 books and more than 60 scientific articles in various international peer-reviewed journals. He is a recognized PG and PhD guide at Rajiv Gandhi University of Health Science, Karnataka, Bangalore. He is a recipient of various academic awards like the Contingent Grant Award for CCRAS, New Delhi, and Pratibha Puraskara Award for Social Services in Treatment of Alcoholic Disorders and Paralysis, and Bishop 2018 Best Doctor Award and Best Paper Presenter Award at various seminars and conferences, to mention a few. He is specialized in mental health care consultation, clinical research, research methodology, and medical statistics workshops, examinations, and workplace stress management workshops, and enhancement programs, healthy parenting talks, adolescent education programs, quantum energy medicine, invited talks on yoga, meditation, etc. We are extremely obliged to have you here, sir. Now, I would like to hand over the session to Dr. Suhas Kumar Shetty. Over to you, sir.
Thank you very much.
Thank you, sir.
At the outset, on behalf of the organizers, I extend my gratitude for inviting me and being able to share a few of my clinical experiences in the area of mental health. So I highly appreciate the efforts taken by Ayurveda College Coimbatore and DIKSHA Foundation for being organizing a very big program on a virtual platform and which has reached across the globe, covering various important and practical and applied aspects of Ayurveda. As truly mentioned that this is truly Ayurveda decoded. And today I'll be very happy to share a few of my clinical experiences in a very important and vital area, not just restricted to the area of mental health, but also in the general practice. So in today's session, I'll try to probably share most of my clinical experiences and especially talk about the concept of Sattva-Vajaya Chikitsa in the present era. So without wasting much of the time, probably I'll try my best to start the session and probably try to wind up the session of my presentation by 7:75. And I'll be very happy to take up the few important questions by the audience and the participants at the end of the session so that we could wind up this session maximum by 7:25 and get ready for the next session scheduled at 7:30. So let me just share my slides. So are the slides visible?
Yes, sir, it is visible, sir.
Okay, thank you.
Thank you, sir.
So, dear friends, today I'll be talking about this concept of Sattva-Vajaya Chikitsa in the present era. See, whenever we talk about health, disease, its management, we always feel that Ayurveda is very holistic, Ayurvedic, very comprehensive, and consider all the important facets of the clinical manifestation. And that is where probably when we talk also about its management, we see a very, very comprehensive approach that Ayurveda talks about in terms of its approach towards disease management. And this is not only mentioned for the disease management, but also when we talk about the disease prevention or even the promotion of the disease, promotion of the health, we always consider this important aspect. So whenever we talk about health or disease, Ayurveda has talked about the three dimensions, which is called as Sattva, Atma, Sharira. So these are the three Tridanda, or what is commonly called as a basic tripod. And every aspect of maybe we're talking about health, or we are talking about the disease, we are talking about approach, diagnosis, or even for that matter, the management treatment protocols, we always have these three basic components to be considered whenever we are treating the cases. So even in cases of the disease management also, we have these three basic aspects. So whenever we talk about the clinical practice, very oftenly we see that most of the physicians focus on the treatment in terms of understanding and approaching the body. So we try to do all possible diagnosis. There may be the Trivida Pariksha, Shadvida Pariksha, Dashvida Pariksha, Ashtasthana Pariksha, and try to see what we can perceive about as an individual in terms of the body. We go a little beyond and try to see what we can perceive beyond the body and try to assess whether there is involvement of the mind or the manas. And that is where we try to explore the possible causes of the disease related to the mind and what could be the possible reason beyond that. And when we go a little deeper to that, we also find that sometimes it is just beyond the body and mind. There's something else which need to be considered. What in the present scenario we talk about the conscious or the spiritual aspect or spiritual dimension of the health and diseases. So we need to go a little beyond the mind and try to address these issues. And that is why probably if we can understand that we are not just limited to the body, we take a step ahead on addressing the problems of the mind, and we take a further step forward to address the problems related with the conditions or the problems beyond the body and the mind. So that is why whenever we talk about the disease management, Ayurveda talks about the 3 formats of treatment, which is called as Daivapasha Chikitsa, Yuktivapasha Chikitsa, and Sattva-Vaja Chikitsa. Basically, this classification is based on whether we are addressing the bodily humors or the Sharika doshas, or whether we are addressing the psychological or emotional humors. So based on that, this classification is done. And there is one more important reason why this classification has been done. It is based on identification of the treatment protocols related with the doshic manifestation. Like for example, if we're able to understand the parameters, the doshic parameters, the involvement of whether it is Vata, Pitta, and Kapha, then probably we have one set of treatment. And if we're not able to understand the exact involvement of the doshas, we have one more set of treatment. The other important aspect of this classification is that whether we are able to identify the cause of a disease, because Ayurveda strongly believes in the cause and effect phenomena, what we commonly call as Karya-Karana Siddhanta. Like if there is a manifestation, if there is any clinical outrage, it is definitely because of some particular cause. And most often we are able to identify the cause. And if we are able to identify the cause, we have a different set of treatment modalities. On the other hand, if we are not able to understand, or if we are not able to understand the cause of the disease, then you have something called as the different treatment modalities. So similarly, when the bodily components are involved, we treat with the help of Yuktivapashraya and Daivapashraya. And when the psychological humors or the Manasika doshas are involved, we treat with the help of the Sattva-Vaja Chikitsa. So that is why we have this basic classification. As mentioned, if you look into the very first chapter of Charaka Samhita, Sutrasthana, first chapter, shloka number 58, which says that Prashamyati Aushadam Purvam Daiva Yuktivapashrayehi Manaso Jnana Vijnanam Dhairya Smriti Samadhibhi. So this is probably the very basic classification of the treatment mentioned in Ayurveda, that if we want to address the Sharika doshas, we have to take the help of the Daivapashraya and Yuktivapashraya. In that, if we are able to identify the clinical manifestation, we're able to identify the causative factors, we're able to identify the doshic manifestation, use Yuktivapashraya. And if we're not able to do or identify any of this, then go with the Daivapashraya Chikitsa. And if you feel that it is because of the psychological involvement and disturbing the Manasika doshas, then treat with the different modalities of Sattva-Vaja Chikitsa. But Ayurveda never differentiates between the body and mind. They're always interrelated. Like Sattvam cha Shariram Anuvidhiyate. Techa Vikaraha Paraspar Anuvartamanaha Kadachit Anubadhanti Kamadayo Jvaradayascha, as mentioned in Charaka Vimanasthana, saying that these are always interrelated to one another. It depends upon how they will have the influence or impact on each other. So that is why whenever you're treating maybe a psychological disorders or a somatic disorders or a psychosomatic disorders, we probably try to treat them with all the three possible line of treatment. But in today's session, I will restrict myself to only the principles and practices of Sattva-Vaja Chikitsa and how we could apply in terms of the present scenario. So the beauty of Ayurveda is that you get a lot of sutras, we get a lot of material concepts in terms of Ayurveda. But sometimes what we generally lack is the methods or the approach that need to be adopted in terms of the treatment management, especially for a common man. Maybe for a person who is intellectual enough, we can even just a sutra may be enough. But for a man with alpa buddhi or a common man, sometimes we do not have the exact methods for overcoming this concept. The same applies for the Sattvaja Chikitsa also. We get a lot of references that this is a mode of treatment which aims at restraining the mind from unwholesome objects. We get few of the techniques like Dhi Chikitsa, Dhairya Chikitsa, Atmadi Chikitsa, Manaso, Jnana, Vijnana, Dhairya, Smriti, Samadhi, etc. But when it comes to the clinical practice, how we should adopt these techniques, how to approach these techniques, how to use these techniques in the clinical scenario, and especially what are the patients who are indicated for these techniques? What are the protocols or the methodology that need to be followed? What is a possible clinical outcome? We may not be elaborately been finding in the textbooks. So that is where probably if we can go to the contemporary sciences and if we try to incorporate the basics, we can definitely help the patients better. And that is where probably Ayurveda approach towards the disease and health as well as the treatment becomes very, very unique. And that is probably the reason why we have this treatment modality called as Daivyapasha Chikitsa, Yuktivyapasha Chikitsa, and the Sattvaja Chikitsa. As I already mentioned, the Daivyapasha Chikitsa and Yuktivyapasha Chikitsa are primarily focused for the somatic conditions. The Sattvaja Chikitsa is primarily addressed for the psychological condition. I again repeat, it is primarily, it is not that we should not use for each other, but it is based on the primary focus that we are talking about. There is one more way of classifying the treatment or chikitsa as described in Ayurveda, that we use Dravyabhuta Chikitsa and the Adravyabhuta Chikitsa, which is commonly classified as the pharmacological treatment and the non-pharmacological treatment. So the Dravyabhuta could include the Abhyantara Chikitsa or Bhai-Parimarjana Chikitsa, Shodhana, Shamana, etc. And Adravyabhuta Chikitsa involves all those upayas or techniques where probably we may not use an alert or inherent treatment modalities. Okay. So basically where we should use it. See, whenever you feel that there is an involvement of Stulakaya, then you use the treatment called as Dravyabhuta Chikitsa. On the other hand,
Participants, please note, sorry for the inconvenience. The speaker is having some technical issues. We will be right back. Please do stay connected with us. Dear delegates, please note, the speaker is having some technical issues. We will be right back. Please do stay connected with us. Dear delegates, please stand by. The speaker is having some technical issues. We will be right back. Participants, please note the speaker is having some technical issues. We will be right back. Please do stay connected with us. Dear delegates, please note the speaker is having some technical issues. We will be right back. Please do stay with us. Hello, sir. Can you hear me, sir? Sir? Sir, can you hear me, sir? Dear delegates, please stay with us. The host will join. The speaker will join you. Sir, can you hear me, sir?
Yeah. I'm sorry.
Welcome back, sir.
There's some technical issues.
That's
Thank
okay,
you.
sir.
Yeah.
Welcome back, sir.
Yeah. Yeah, you're able to see the slides?
Sir, yes, sir.
Yeah. So we're just talking about the plausible differences where we could use Dravabhuta Chikitsa and where we use Adravabhuta Chikitsa. So Dravabhuta is used probably when you understand that the Sharira, or especially the Stula Sharira, and when there is the involvement of the Sukshma Sharira, we use Adravabhuta Chikitsa. And the basic difference between Dravabhuta Chikitsa and Adravabhuta Chikitsa is Dravabhuta is more of a pharmacological approach, whereas the Adravabhuta Chikitsa is non-pharmacological. Dravabhuta involves the Shodhana Shamanadi karmas, and Adravabhuta Chikitsa involves the Vaya Darshanadi Prayogas. As I said, that it is mainly affecting on the Stula Sharira, whereas Adravabhuta Chikitsa affects on the Sukshma Sharira. This classification of the upayas or Adravabhuta Chikitsa can again be done based on the negative modalities of treatment and the positive modalities of treatment, like Bhayadarshana, Bandhana, Vatsana, etc. are coming under the negative treatment modalities, and Vismarana, Vismapana, Swapna Samvahana, etc. comes under the positive treatment modalities. Now coming to the Sattvaja Chikitsa. The Sattvaja Chikitsa is defined as Sattvajam Punaha Ahitebhyo Arthebhyo Manonigraha. In other words, it refers to the psychophysical or spiritual modalities which is designed to achieve a regulatory mechanism or a balance between the human psyche in dealing with the environmental stresses, which are Indriyarthas, and the emotional stresses, which are the Manoarthas. Like we have the external stresses, which is the form of the Indriyarthas, and the internal stresses, which is Manoarthas. And the balance between these two is called as the Sattvaja Chikitsa. And whenever you're doing Sattvaja Chikitsa, it's important to understand basic components, like what is the prakriti of an individual, what is the disease manifestation, what is the clinical manifestation, what is the doshas involved, what is the sattva. So there are different, because what happens, especially as you know that those who are having aura sattva, they can easily succumb to the different psychological disorders. So that's the reason why you may need more sessions of psychotherapies or Sattvaja Chikitsa. You may have to put a lot of efforts in terms of the Avara Sattva people. On the other hand, if the person is having Pravara Sattva, like 1 or 2 sessions of Sattvaja Chikitsa and a little bit of motivation is enough for a person to come out of the problem. So let's see what are different methodology that are adopted in Sattvaja Chikitsa. And it is mentioned that Chintyam Vicharyam Uhyam Deyam Sankampamevacha Yatkinchit Manasogdeyam Tat Sarvami Arthasanyakam. And these are the methodology which can help in regulating the Ayurvedic psychotherapy or Sattvaja Chikitsa. Like it helps an individual to regulate the thought process. It can help to replace the ideas, channelize the presumptions, polishing their objectives, and helping an individual to take the right decision. Like for example, let's take an example. Suppose a couple comes for the preconception counseling, and they have a lot of myths and misconceptions about the counseling, about the conception and the pregnancy, the post-pregnancy care, etc. Then it is very important that you have a clear understanding of what is do's and don'ts, what to be done, what not to be done. So clear thought process, and give them an idea of what they have to expect and how they should prepare themselves to the future objectives. And what is their, like Shreyasi Praja could be the objective of the Sattvaja techniques, and help the individuals or the couples to take the right decision about the conception. And this is how different methodology can be adopted in terms of the treatment. Then the different domains. What are different domains that can be adopted in Sattvaja Chikitsa? As mentioned in Ashtanga Hridaya Sutrasthana, very first chapter, like Di Dhairyatmadi Vijnanam Mano Dosha Aushadam Param. See, it helps an individual to understand or uplift their intelligence. It also boosts the confidence and determination of an individual. And above all, it stimulates the consciousness or setting the self-realizations. There are different techniques called as Atmadijnana, which I'll talk at the end. It is not just an individual. It encompasses various concepts related with the himself and the people around him. And what are different techniques that has been mentioned in Ayurveda, which are to be used as the techniques for Sattvaja Chikitsa? We just find these words and a few references or few information in the Chakrapani Tika. But how to adopt them, that's what I'm going to highlight in the upcoming slides. Like Jnana could include all the insight-oriented approaches. Vijnana, the educative approach. The Dhairya, the supportive approach. Smriti refers to the cognitive approach. And the Samadhi refers to the psycho-philosophical or the psycho-philosophical approach. So let's see how we can understand each of these techniques. See, what probably I'll try to do is probably help you to define these techniques, then tell you what should be the goal of this particular techniques, what are different methodology or the techniques that can be adopted to achieve this particular techniques, and what are the expected outcome out of these techniques and what are different indications of these techniques. Like for example, Jnana Chikitsa or Jnana Therapy refers to Jnanam Adhyatma Jnanam. It refers or helps an individual to develop an insight about himself, what he is, what he should do, what he should not do, which is commonly seen in various diseases like depression, obsessive compulsive disorders, delusional disorders. You see such problems. And it helps an individual to understand his constitution. It helps understanding the attitudes, beliefs, experiences of the self. It also helps you understand the source of his problem and very importantly helps you to evaluate and mentor or motivate the individuals. And if you do this therapy, what is the expected outcome? It helps an individual to get into the improved degree of responsibility and behavioral control, emotional maturity, and especially the better adaptability and self-realization. And where can we use this therapy? It is very useful in case of depression, ego deficits, passiveness, anxiety, etc. Next, coming to Vijnana therapy or Vijnana Chikitsa, Vijnanam Shastra Jnanam. So it helps an individual to understand the nature of illness and helps in coping capabilities. Like the techniques that we can use is identification, the irrational fear or belief, providing critical knowledge about this problem to understand the problem, and especially educating about the problem emergencies, complications, risk factors about the diseases. The outcome is avoidance or relieving the misconceptions, better coping skills, and especially it develops a good rapport with the therapist. And where we can use this? In most of the psychosomatic disorders, phobia, hypochondriasis, anxiety, etc. Next, coming to Dhairya Chikitsa, Dhairyam Anunnati Chetasaha. So it helps an individual about the mental balance even when a person is under stress. Especially it helps an individual for the coping abilities. The techniques used are the counseling based on the family support, the motivational enhancement therapies, identifying the modification of the environment, and especially to boost the self-confidence of the individual. The expected outcome is better coping abilities and change from negativity to the positivity. Okay, and especially it is helpful in phobia, anxiety disorders, depression, etc. Smriti Anubhutartha Smaranam. So it helps an individual to understand the exact nature of the object of the event and helps an individual to develop an insight about the present problem and understand the unrealistic nature of his problem. And the hidden conflicts, which are primary source of emotional illnesses, are exposed will be the basic outcome of this particular therapy. And where can you use it? Like hysteria, anxiety disorders, obsessive compulsive disorders, different types of phobia, etc. And above all, the samadhi, vishayabho nivarteya atmani manaso niyamanam. So it helps the person to restrain the mind from the worldly objects and meditating on the spiritual dimension of the personalities. So the goal is to achieve the higher level of awareness. The meditation and avoiding and applying the different techniques of the yogic practices, the Ashtanga yogas, comes under samadhi. And it is helpful not only for a person with problem, but also to prevent the disease and to take a person to the higher level. It can be helpful even in the healthy individuals. So this is how we can apply clinically the different 5 important techniques that is mentioned in Charaka Sutrasthana, first chapter. Jnana, Vijnana, Dhairya, Smriti, and the Samadhi. So what could be the possible mode of action of all these techniques? So basically, all these 5 methodology, 3 dimensions, the 3 domains, and 5 techniques ultimately helps or acts on the impaired rajas and tamas and results in the replacing the emotions, channelizing the presumption, and proper control of the patients, thereby resulting in manonigraha or controlling the mind from the unwholesome thoughts, and ultimately helping in increasing the sattva guna or the balancing the property of the mind. And this is will be the final goal or outcome of the Sattvaja Chikitsa. And this is how the Sattvaja Chikitsa act or helps in different psychosomatic, psychological, as well as somatic conditions. We also talk about the Paraspara Pratidvandva Chikitsa, which is again important component of Sattvaja Chikitsa, where the substitution or replacement of the emotions with the opposite ones are done. Like for example, the person is very dull, very sad, probably finding him or helping him to find out the reason to be happiness, or transforming him from the low mood to the higher level of the excitement or happiness is very, very important. And along with that, there are different techniques which can be adopted, like especially the sadhrutta, which can help a person to understand, realize the behavioral and moral codes, the different mind controlling techniques, which could be like yoga, pranayama, meditation, like especially the support that can be given by the family members, friends, or the therapist, and different mental equanimity techniques which are mentioned in yoga. So Sattva Chikitsa refers to, as I said, Atmadi Jnana. And here Atmadi Jnana refers to Atma Jnana, Desha Jnana, Kala Jnana, Kula Jnana, Shakti, and the Bala. This is the reference that you get from Charaka, Sutrasthana 11th chapter, about what should be considered as Atmadi Jnana. So whenever you're doing the therapies, you should consider different components like the place, time, person, his capacity, ability to render the therapies related with the Sattvaja Chikitsa. And it could be different types of Sattvaja Chikitsa, like individual Sattvaja Chikitsa, group Sattvaja Chikitsa to the family. And above all, for most of the thing, you just need to motivate an individual in terms of Sattvaja Chikitsa. You can also advise different yoga therapies in case of the different Sattvaja Chikitsa, in terms of like based on the different koshas. You can use like for Annamaya Kosha, Asana, for Pranamaya Kosha, Pranayama, Manomaya Kosha, meditation, Vijnanamaya Kosha, Bhajan, and other Karma Yogas, and for Anandamaya Kosha, the higher level of practices. See, basically, all this works based on the Trigunas. See, ultimately, we should nurture the Sattva. We should make all necessary actions for calming the Rajas and overpowering the Tamas. Because if an individual has a clarity, wisdom, peace within, and ability to love, most of the Sattvaja Chikitsa can be practiced, and it will go to cure most of the problems related with the psychological things. So that is why we should nourish it and cherish it. And how can one lead by these practices of Sattvaja Chikitsa? One can lead a healthy and happy life, because if one can understand by righteous action, the happiness can be sustained. That is why in Ashtanga Hridaya it is said that if one can do the regular practice of the study, contemplation, will, and constant efforts, he can lead a harmonious, peaceful, and purposeful life. And above, that is why probably Atmadi Jnana refers to knowing the self, self-realization, self-determination, self-actualization is the ultimate aim of Sattvaja Chikitsa. And not only just knowing, but also realizing. And above all, if one can practice these techniques, then that becomes the wisdom of Ayurveda, and you can get the ultimate benefit of the Sattvaja Chikitsa. And above all, like along with this, the different food to curtail the happiness, mental health, etc. has been mentioned. So that is why person should be physically active and mentally relaxed. But what is happening now? We are mentally active and physically sedentary. And that becomes a basic cause for most of the non-communicable diseases like diabetes, hypertension, stress-related disorders, obesity. So basically we should learn different basic techniques to keep our physical body active and mind relaxed. And that is where probably it is said that one should not get exposed too much of fear or any forceful acts. Because if a person gets exposed to this, he can always get into trouble. And that is where you should have the vigilance to get away from such problems. And if at all you come across such scenario, you should have the stability to overcome that. See, that is why probably we have talked about the two treatment modalities, like Ichha and the Dvesha, the positive modalities and the negative modalities. See, always sometimes you may have a question, why we should have this negative emotions? Because negative emotions are important for survival or to check and real testing of an individual. And to develop and for the growth, you need the positive emotions. That is why both for survival and growth, you need the combination of negative and the positive emotions. See, life is full of uncertainty, and uncertainty is the beauty of life. And if we can make this particular emotions, see, that is why they are called as Dharaniya Vegas. See, Dharaniya do not refers to the Vegas which should be suppressed, sometimes which we wrongly correlate with to be suppressible urges. In fact, it is not that we should suppress them. We should have a control of them and realize that they should not go out of normalcy. That is where this Dharaniya Vega has been mentioned. And that is why you should always discover our true path in the true meaning of life. So that is where appreciating the life we have, not the ones we want, be gratifiable and recognizing who we are. Authenticity and self-acceptance is what Ayurveda talks about. Nearly all people are capable of doing much more or able to gather much more happiness than we have. Only thing is see our own potentials and especially create the opportunity to invest in your own highest self-belief. So that is where probably there are different diseases which has been mentioned and what could be the possible Sattva Chikitsa that need to be. I've just tried to compile few of the common diseases, common basic emotional disturbances and how we can come out of this particular problems. So now let's come to the clinical aspect of probably taking few case reports and how exactly we should do the Sattva Chikitsa. I'll just take one example of suppose a patient of Apasmara comes to us. What should be our Sattva line of treatment in such patients apart from the routine pharmacological treatment? See, whenever a patient comes to us with epilepsy or any of the seizure disorders, there will be a lot of fear or anxiety among the patient as well as the bystanders. See, first of all, you should confirm that this is a case of Apasmara, not just a case of any of the phobia or even for the pseudo seizures, etc. So always acknowledge the seizures and ensure or confirm that it is really a seizures. That is why whenever a patient comes for the counseling for the first time after the seizures, ensure that you are acknowledging him, probably trying to understand the causative factors, give him some basic ideas of that issue, what he should do, what he should not do, especially like driving, the role of the meditation or medications, and what could be done for the health, etc. And especially try to help him, like what he should do, like sleep deprivation will cause apasmara, use of alcohol, social drugs. So ask him to avoid such things. So especially it could be associated with binge alcohol drinking, sleep deprivation, driving, etc. So you should give a clear idea that one should not drive at least for 5 to 8 years if it is a frank epileptic seizures, and especially not to drive for more than 1 hour initially, to avoid driving for more than 1 hour. Especially if she is a pregnant lady or if she's a breastfeeding mother, she should take them extra care. And especially there could be a lot of cognitive and emotional impacts. So give them, help them in understanding the problems like difficulty in attention, concentration, memory, etc. Because it is said as a sattva samplavat. That is what happens at the chronic aspects of it. So all this should be, and very above all, help a person to understand the cause, especially from the Ayurvedic perspective, what the cause of their problem, what could be the cause of their apasmara. So help them to understand what is their prakriti, what is their sattva, whether there was any life events which was leading to such a psychological manifestation, any head injuries, any infections, etc. Any changes in their lifestyle or dietary habits which has led to such seizures, and especially whether they have any lifestyle disorders, whether there is any lifestyle modification that they have done which has led to their problems, and whether this is because of some secondary medical conditions like fever, diabetes, or a stroke or cancer, etc., which has led to the manifestation of apasmara. Or especially try to understand whether there is any psychological determinants which can be the cause for the excess manifestations. And this should be done, and then probably try to understand what is the level of their samprapti. At what level the problem is arising. Dhi, where the problem is with the decision making, proper perception. The driti, where a person is not having the self-control, excessive indulgence in allurements, and especially the aspects in terms of the smriti vibramsha. At the same time, we should understand between the apasmara roga and apasmara vega, and then the treatment modalities become different for these two aspects of the treatment. So this is how probably we should try to evaluate in depth in terms of Ayurvedic aspects and try to give them the proper Sattvaja Chikitsa of not only the patient but also the bystanders of possibly how to live with this apasmara and how to lead a normal life. So very commonly you come across, like I'll take few more examples. Very oftenly people come with suicidal tendencies. And that is where probably Sattvaja Chikitsa will have a greater impact. So never neglect anybody's if a person has severe depression, especially with the suicidal thoughts. So always give them the support, give them the reason to live in this life, and especially the family can play a very, very major role in identifying their behavioral changes. And that is where probably the care of the family can play a very, very major role. Never ever neglect any patients who come with depression. Especially depression and substance abuse go hand in. That is where probably giving the family support and ask the patient to come regularly for the treatment, observing for the withdrawal symptoms, managing it physically by Vichvapasha, and then once a person is properly having the insight, giving him the proper Sattvaja Chikitsa. And Sattvaja, especially in terms of the alcoholic and depression, could be individual Sattvaja Chikitsa, could be family Sattvaja Chikitsa, and as well as the group Sattvaja Chikitsa could be followed. See, it is not that we have to just follow the adults for their problems. Even the small children sometimes can also have the issues related with the psychological issues. So they could, nowadays, there are a lot of children, patients who come with small 5-year-old, 6-year-old children with anxiety, temper tantrums, teenage aggressions, depression, behavioral problem, bedwetting, etc. And if we can just give them sufficient time analyzing their problems, and then see, that is why probably as a therapist you have to have a lot of patience in terms of trying to go into the depth. See, this is one very, very interesting case nowadays, the newer diseases called as electromagnetic hypersensitivity, where the excessive use of the mobile gadgets, excessive usage of internet, laptops, etc., can lead to various types of disorders related with the misuse or excessive use of these radiations. And they can have various types of vata or pitta related symptoms. And if we can definitely treat them along with the Yukta Pasha Chikitsa, especially the Daiva Pasha Chikitsa, helping them to have the Dhairya Chikitsa, Santvana Chikitsa, Ashwasana Chikitsa, and encouraging them to do what they like. And if you do that, definitely you are able to help such patients. You can also do different types of relaxation techniques, meditation techniques, using of the psychotherapies, especially the music therapies. You can always help the patients. So you can always use some allied therapies for managing the patient's conditions. So irrespective of the age, whether it is pediatrics till geriatrics, each one of the patients has their own issues, and you should use different specialized techniques to help these patients. So maybe boy, girl, adults, female, male, everyone can be helped with the help of Sattvaja Chikitsa. And above all, you should also take the self-care as therapist, because sometimes it takes a lot of efforts handling the psychological ill patients. So you also as a therapist or as a counselor should take care about your physical and mental health. So there are simple relaxation techniques which can be used, especially in anxiety disorders. So maybe let's, for the next 10 minutes, quickly take you to the contemporary knowledge of what is counseling and what are different knowledge that you should have in the present era. Like basically counseling is essentially a process in which the counselor assists the counselee to make the interpretation of facts related to the choice, plan, or adjustment which he needs to make. So it's a series of direct contacts with the individual with the aim to assist him in changing in his attitudes and behaviors. So whole purpose or aim of the counseling is self-knowledge, self-realization, and self-development. And the whole purpose of the counseling in any disease for that matter is for assistance, for development, for giving him the right scientific information, for inspiration, to help him to find the solution, and above all, for the motivation and the encouragement. And as I said, as a counselor or as a person who are involved in the Sattvaja Chikitsa, you should have some of the special qualities or the skills. And these skills are very, very important to be a successful practitioner in Sattvaja Chikitsa. Like you should have good technical knowledge. You should try to get all the information. Like for example, I'll give an example of a boy who had sudden change in his attitude, like a very active person, very agile, very good in studies, suddenly loses interest in studies and becomes mute. And that is what he came to our OPD a week back, and suddenly there was a change in his behavior. So, and person is not at all ready to tell what exactly happened. You need to put a lot of efforts to motivate him, encourage him. Different allied techniques should be used for a person to come out of this problem. And that is what you should be able to answer his question, and you should maintain the professionalism. You should be observant, unbiased, empathetical, and above all, probably you should be able to listen carefully, give a lot of open-mindedness, and respect the rights of the patient. So these are some of the important qualities that you should have as a good counselor. So counseling process will generally have 5 stages. And that is why whenever you're doing any counseling session, you should have a clear idea what is the objective or goal of these particular sessions. Like for example, if the patient has 5 or 6 problems, like I have the interpersonal relationship with my husband, I do not get good sleep, I get a lot of anger issues, I do not be able to digest the problem. So there could be so many issues. So you need not address all the issues at a time. In one counseling session, let's say, which is that issue which is troubling you a lot? And the patient says, it's my anger. Then you should say that, yes, there are so many issues. And in today's session, we are going to address your anger. And this is what are the different techniques. Like you should count reversal, should change its places. You should make the note of what are those things which made you angry. How did you react it? And what could have been done better? So make a crisscross assessment of your emotional disbalance. And this is what you should be able to address. And that is why any counseling session, until unless it's a very major issues or you're talking for the patient for the first time, it's okay. Otherwise, a counseling session should not last for more than 20 to 30 minutes with a specific goal of addressing a specific issues. And initially, it's very, very important that you develop a rapport, build a good rapport with the patients, then probably help the patient to assess or diagnose where exactly the problem is. Then you should be able to formulate what will be your outcome or what will be your counseling goals, and then probably use different interventions or the problem solving techniques for the patients. And at the end, you should be able to summarize the session and then probably fix the next appointment, like maybe next week or tomorrow after 2 days. And then what could be the issue that we are going to discuss in the next sessions. And this is what probably you should be able to try to do in such each of the sessions. So these are the 5 important stages that generally should be a component of your counseling process or a counseling session. Initially, develop a good rapport with the patients, assess the problem or area that you are addressing in this session, and what is the expected outcome of this particular session, and then you give the actual interventions or the problem solving coping skills to the patients, and then end the session with the next session goals. So most importantly, you should also be helping the patient to prevent the mental disorders. And this is what I always use this model called as ABCD 4321 model, where A stands for away from distractions, B stands for better planning and prioritizing your life, C being cheerful, being active, and finding time to relax yourself, D daily exercise. At least 20 minutes of physical exercises daily is very, very important to maintain your mental health. At least plenty of water, at least 3 to 4 liters of water, 3 times timely balanced sattvic food, 2 times of prayer or short meditation and yoga, and at least have one recreational activities, maybe singing, dancing, drawing, going for a ride. It could be anything, but have one recreational activities based on your interest, which is going to keep you motivated, which is going to keep you active, and above all, probably help you to just come out of the routine mood. And because what happens sometimes, there is so much of accumulation of the negative thoughts, so much bad experiences. Just as we do the shodhana for the body, you also need to let out all the negative energies outside the body, and that is why you should develop your own techniques, own type of therapies which could work for you. See, each one of us, all the things may not work. So you should understand what really fits you, what really suits you, and based on that, you should do it on a regular basis. So to conclude, I think there could be no better concluded remarks rather than this quotation, which occurs both in Charaka Sutrasthana second chapter as well as in Sutrasthana of Ashtanga. Nityam hita ahara vihara sevi samikshakari visheshu asaktaha dataha samaha satyaparaha kshamavan aptopa sevicha bhavanti arogaha. If a person indulges in regular intake of balanced diet and physical activities, if a person is very critical or analytical in what is good, what is bad, what he should not do, what he should do, and be very critical in understanding the true nature of life, true purpose of life, being meaningful of what is the ultimate aim of the life, a person can definitely be very, very happy. Above all, being detached with this particular worldly environment and look at the broader or the super spiritual dimensions or consciousness of life, and be kindful, charitable, helpful for people who are needing the help in and around us. And very importantly, to have that balance of having the mental equanimity, not getting too much excited, not getting too much depressed, and maintaining that samavastha. Like I said, samatvam yogamuchyate, karmasu kaushalam. So these are the different skills that one should have. Being truthfulness is very, very important in life because it always keeps you active. It also keeps you positive, and above all, probably it gives you a lot of positive energy to lead a happy and healthy life. And whenever you come across some people who have made some mistakes, and you should be having that quality of forgiving these people, and always try to help others, respect especially the teachers, parents, and all the elders, because they have seen their life, and if you can take their advices, take their help, then definitely we could see that many of the mental disorders, many of the physical disorders, many of the psychosomatic disorders can be easily be managed with the help of these techniques. So I would like to just end saying that I hear and I forget. I see and I remember. I do and I understand. This is very, very important in Sattva-Vaja Chikitsa because whatever I've said sometimes may look very, very simple. And when you start seeing people doing this, you just try to remember. But when you start doing these therapies, these techniques, making a great impact on the people, great impact on the lives of the people, then probably you'll realize the greater potentials of these techniques, which really has wonderful, wonderful power of healing. So experience is beyond logic and science, and it is always seems impossible until unless it is done. See, after practicing Manas Yoga for almost 2 decades, I really have understood that if we can just tap their thoughts, actions, behaviors, and sometimes 1 or 2 sessions of Sattva-Vaja Chikitsa can transform the life forever. And that is where you should have the greatest techniques of understanding the individual in a very comprehensive way, not just focusing on the physical aspect, going little beyond that, touching their psychological and emotional aspects. And sometimes even going beyond to touch their consciousness, or even for that matter, the spiritual component of an individual. I once again thank the organizers for these wonderful opportunities. And I always feel that true health is just more than the absence of the disease. It is a full expression of life. So you can refer this particular article from where published from our department, where most of the references have been taken up in this presentation. So thank you once again. I thank the organizers for these wonderful opportunities. And as promised, I have stopped my presentation exactly at 7 o'clock. Thank you. Now I'll be expecting a good number of questions by the participants so that we could have the direct interaction with the audience. Thank you. Thank you very much.
Thank you. Can post their questions in the chat box. Delegates, please note, you can post your questions in the chat box or you can raise your hands so that you can ask the speaker questions directly. Dear delegates, please note, you can post your questions in the chat box. Yes, sir, there are some questions, sir. Shall we move on to the question and answer session, sir? So can you hear me, sir? Sir, you are not audible, sir. Sir, please unmute yourself, sir.
Yeah, I was not able
Yes.
to. Yeah, now I am able to do it.
Yes, sir. Sir, shall we move on to the question and answer session,
Sure,
sir?
sure. Most welcome.
Sir, there is the first question, sir. So can we use modern medicine along with Ayurvedic medicine? Is there any reaction with modern medicine, chemical and plant chemical components?
See, I think this is a very, very important question, or probably a very, very practical question, especially when it comes to your clinical practice. And that is what we have also realized, because many of the patients, when they come for Ayurvedic treatment or therapies, may be already on some medications, and that too sometimes for a very long time, maybe for 5 years, 7 years, 12 years, they are on some antipsychotics, antidepressants, or anti-epileptic drugs that they come to us. And it is very, very important. And patients sometimes maybe the primary reason why they approach an Ayurvedic doctor is that they feel that, doctor, I have been taking these modern medications. I want to stop these medications and start the Ayurvedic treatment. Okay. And patient sometimes even stop the medications and come to you saying that, okay, because you are starting Ayurvedic treatment, I stopped it. Probably this is not a very right approach whenever your patient is on sufficient long time of the treatment. So if the patient is already on the antipsychotics or antidepressants or any of the psychotropic drugs, we should not stop the medication at once. Probably if we can realize the patient's symptoms and what is their side effects, etc., you can always analyze the patients and then probably try to analyze the doshic involvement of the patients. And once you feel that patient is ready, before you want to taper the medications or you want to add Ayurvedic medications, I personally, in my practice, always feel that you should go for Shodhana line of treatment, especially the Vamana, Virechana, Basti, especially they really help before you could plan for the adding the Ayurvedic treatment or probably tapering the medications. So when a patient is coming to you for the first time, probably try to patient do the Deepana Pachana, do a course of Vamana or Virechana. That really helps. And then probably you can add the therapies or you can add the Ayurvedic treatments. But all type of Ayurvedic treatment and modern therapy do not go well. There are many such incidences where we have tried to probably add Ayurvedic treatment and it didn't work much in a few of the conditions. See, the reason is sometimes you should understand the pharmacological applications of these medications which are really working there. I'll just give one example. Like there are different types of antidepressant drugs. If you look for the major categories of antidepressants, you have the tricyclic antidepressant drugs. You have the specific serotonin reuptake inhibitors. You have monoamino oxidase inhibitors. Especially when you're using patient is already using monoamino oxidase inhibitors, which is generally used in case of atypical depression or treatment-resistant depression. It doesn't go well with the Ayurvedic treatment because the patient should be avoiding the tyrosine-related proteins, which is commonly present in milk and milk products. So that is why you should not use the Grita Prayogas like Kalyanaka Grita, Brahmi Grita, etc. If the patient is on monoamino oxidase inhibitors, maybe you should taper the medicines, stop them, look for a window period for 15 to 21 days, and then probably start it. Otherwise, it may not work. So that is why probably all the times it is not that we always should able to manage Ayurvedic and modern treatments. It depends upon the condition and it depends upon the pharmacological and the therapeutic and the adverse outcome that is there with the long-term usage of medications. Do the Shodhana and try to analyze them. And then based on your clinical practice, you can always add on the therapies. But always, it's always blindly do not add on the Ayurvedic treatment without due consideration of its background.
Thank you so much, sir. So there is another question, sir. So how to plan treatment in Abhasmara Vega and Apasmara Yoga? What difference should be there in our approach, sir?
Very good. I think this is also a very common clinical problem that we could always face. See, basically, as you all know, that Apasmara or what we commonly call it as epilepsy is a episodic disorders. Like it is not that always patient will have the episodes. Okay. So that is why when a person has the acute attack, so there are different set of the treatment modalities. When the patient do not have the attack, there are different set of treatment modalities. When the patient has acute attack, then probably the line of treatment should be Sanya Prabodhana. And Sanya Prabodhana, where you can use like the Pradhamanasya. And more than that, probably you do not get most of the time chances to treat patients in the attack. And so basically what you should do is you should understand the first aid management. Like for example, at least turn the patients to one side, give some cotton gauze or kerchief in the between the tongue and ask the patient to just not to feed anything and try to restrain the patient from any harmful objects. So that is very, very important. And if at all you can provide, you can use the Pradhamana Nasya, where sometimes you can use Vacha Churna, Katfala Churna, or 2 or 3 tablets of Shwasakuta Rasa can be powdered and you can use it. That can be, we commonly practice that. And this is what the basic thing is, the life-saving techniques. And to regain the consciousness is the aim of treatment in Apasmara Vega. And if it is the patient is not in the attack, patient is attack-free symptoms, then probably you can plan the Shodhana line of treatment and Shamana line of treatment. As it is mentioned, like Vatikam Basti Bhuishtam, Pittam Prayo Virechanam, Slaishmikam Vamanam Prayo, Apasmaram Upacharet, Sarvata Suvishuddhasya, Samyak Ashitasya Cha. So if based on the techniques, we can use Vamana, Virechana, Basti, etc. But as per my clinical experiences, generally we do not plan for Vamana until it's absolutely necessary, because sometimes Vamana sometimes could be stressful, and sometimes patient also can get the attack because of the stress. During the Vamana, the person could get an attack and can land up in asphyxia. So that's the reason why most often we either go with the Virechana or Basti or the Lasya line of treatment, but very few, like maybe once, 2 or 3 patients in a year where we feel it is absolutely necessary to undergo Vamana. With little bit of care, we do the Vamana. Otherwise, most of the patients are undergoing the Virechana, Basti and the Nasya line of treatment. And later on, of course, we follow the Shamana line of treatment along with the other techniques that we commonly follow.
Thank you so much, sir. So there is another question. Sir, some patients won't get satisfaction only by oral advice. Can we use some placebos to satisfy them, sir?
See, that is why sometimes no people always say like it is a faith of the treatment which works more than the actual line of treatment. See, sometimes what happens, I give one medicines and one more doctor gives the same medicines. Sometimes what I give the patient, it may not work. What other person gives, it really, the same medicines could be there. So that is the reason why sometimes it is not just the medicines. See, there is something called, especially if we look to the basic concept of something called as psychoneuroimmunology. See, they say something called as the treatment response. The treatment response is with what intention the patient is taking treatment. So, say for example, the patient comes to me and says that, okay, by taking treatment by Dr. Suhas, I get fine. Okay. I get the patients from all over the world and they come with a lot of hopes and aspirations. And just mere hope that that this particular doctor is going to help me itself is probably more than sufficient. So that's the reason why definitely it is not just the medicines, it is the faith with which the patients takes the medicines becomes more. It is said as one third of the treatment is with the faith rather than the actual medication. But of course, medicines definitely has its own role to play, but it is the faith with which the patients, hope with the patients, the trust with the patients takes. And that is why I see, especially in Ayurveda, the patient is also an active participant of the treatment. Like Bishak Dravyani Upasthata Rogi Pada Chatushrayam. So patient is also equally responsible for coming out of any problem. See, sometimes patient really feels that if we just take some medicines or if we just take some tablets, everything gets set right. Because that doesn't happen. The patient definitely should be able to take his own responsibility, and he also should make necessary lifestyle changes, dietary changes, attitudinal, behavioral changes for making the outcome. See, there is no pill for every ill. It is the will which really matters in a disease.
Thank you so much, sir. So there is a participant who would like to ask you a question directly, sir.
Sure. Most
Dr.
welcome.
Ritika, please unmute yourself.
Good evening, sir.
Yeah, Dr. Ritika, please go ahead.
Yeah, it was a wonderful session, sir. Thank you. Yeah, can we consider hypnotic counseling under Sattvavajaya Chikitsa, sir?
Yeah, see, basically, if you go into the category of Adravya Chikitsa, in Adravya Chikitsa, which is also called as Upaya, if you go to the Charaka Vimanasthana 8th chapter, it ends with saying that Sukha Sopna Samvahana Adi. So this Sukha Sopna Samvahana or Sopna Samvahana Adi techniques refers to that a person should be taken into trance and different therapies can be done in this particular suggestible phenomena of techniques. And that itself is what we get but definitely you just get this particular term and how to conduct this hypnotism, how to conduct the therapeutic hypnotism, what are the different methods or what are the different indications, contraindications, probably may not be available in the literature available in Ayurveda, but definitely there are. That's why I think I just started saying that we have plenty of materials and sutras, but sometimes what we lack in the areas like this hypnotism, etc., is that we do not find sufficient methods of how to carry out these particular procedures. So that is where probably we can use the help of or take the help of the contemporary psychology or the psychotherapy techniques can be used and that can be done. So definitely, I see that is why Ayurveda talks about this level of consciousness as Jagrata Avastha, Sushupta Avastha, Swapna Avastha, which basically means that we can always transform this or a person can be made into Jagrata Avastha with going into the level of the Sushupti and Swapna Avastha and made a person to transform his thoughts from the pre-conscious or the unconscious level. Definitely we can consider this as the Upaya or the Adravya Chikitsa mentioned in Charaka Vimanasthana.
Thank you, sir.
Thank you so much, sir. So there is another participant would like to ask the questions directly, sir?
Sure, sure.
Dr. Anita, please unmute yourself.
Good evening, sir.
Yeah, very good evening, Dr. Anita. Please go ahead.
Sir, I want to discuss about medical astrology. Can we consider medical astrology for this Sattva Vajay Chikitsa in these cases? Actually, we see like medical astrology is a very growing science nowadays. But on the other hand, we are having malpractices also
Yeah.
by the name of medical astrology, like Bali and all that. Jhadfu kind of treatments. So
Yeah.
how to explain that?
See, definitely, there are different types of techniques which we talk about, and even the medical astrology is also a very important techniques. See, in Ayurveda also they have mentioned that sometimes when to take these medicines, when to collect these medications, when to give this medication. They specify a particular planetary time for the usage of these particular things. And even especially when it comes to the concept of the mind and its relation to the lunar movements or planetary movements, especially the lunar movements, there's a relationship. We go to the Shushruta Shairasthana. They have mentioned the adhipatis for different components of the body and mind. And there, Shushruta mentions that it is the Chandrama or the Chandra or the moon, which has been related with the mind. And this is where probably every momentary of this moon is very much related with the psychological functions. I think if you look into the general practice also, patients very oftenly come to us saying that these particular symptoms flare up in full moon day or new moon day. And it is very commonly also observed, like even in my practice also, very typically there is an observation by the patients, and they surrender saying that this really happens, triggers during this particular phenomena. It is because of the influence of this particular nature. And same thing when we are saying about the planetary movements and this astrological science and the different basic concepts also work on that. See, any science or any philosophy for that matter will have its own positive and negative importance. See, that's the reason why sometimes we should not blame the science for the user, because sometimes what happens, if a person is not trained well or if he uses for a wrong purpose, definitely it is the individual, it is not the science to be blamed about. So that's the reason why definitely, and that too, especially in the practice of the psychological disorders or mental disorders, you can definitely take the help of the medical astrology, and that can give the answer for many of the unanswered questions. Also have something called as a Karmaja Vyadis, and sometimes there is a super spiritual dimension of the diseases. See, if you see the patients, why you are having this problem, the patient definitely will not have the answer. At present also, I'm having so many patients where if you just analyze, patient actually do not understand why exactly he is suffering with these particular problems. But you realize that definitely there's something beyond that. And that is where probably use of this Devapasha Chikitsa or different types of techniques can definitely help them. And at least if you're not something very significant, big homas or havanas, etc., at least chanting of some mantras, or at least visiting the temples, or just doing some basic prayers, or even doing based on your beliefs. If you can do some special things, it really gives a lot of benefits. See, even at present, we are doing one such research where we are trying to see the effect of Agnihotra Homa and the Gayatri Mantra in the post-COVID anxiety patients. And we find excellent results with these particular combinations. So, but see, that is why, but it should be done by an expert, and it is done for the purpose of the benefit of the patients without having the commercial usage of this particular science or techniques. That is applicable for all the techniques, and very much so to exploit the techniques of the ancient science.
Thank you so much, sir. So shall we move on to the questions in the chat box, sir?
Sure, Shavantika.
So there is a question. So patients are addicted to many antidepressants in bipolar and schizophrenia, etc. What can we contribute from Ayurveda, sir?
See, as I said, no, I think many of the times patients who come to us in many of the disease conditions, especially in chronic psychological disorders, and that too in case of very serious or severe mental disorders like schizophrenia, bipolar disorders, schizoaffective disorders, or for that matter, substance abuse, chronic insomnia. We always see that they're already on medications, and more than the disease, it is they end up having the side effects of this particular medication itself. Okay, see, definitely, I don't say that one should not take these medications. Definitely, is that it has its own benefits, it has its own utility in the clinical practices. But yes, see, that's why I always said, no, you should make the patients as an active participant of the treatment, and probably if a patient can be given a lot of advices in terms of the dietary lifestyle, and if the patient can get the support in the family, it can really help the patients. And that is where we can see that when these medications are added with the Ayurvedic treatments. See, one thing what I would like to share in this particular, especially when it comes to the patients already on chronic medications, it's better that you can add some agada yogas like Chira Bilvadi yoga or Bilvadi Gutika or Dushi Vishari Agada, etc. If you can just add as a prescription along with your routine line of treatment, it really helps in patients of those patients who are already on some medications. And if you can do this after the Shodhana, it really gives you very good outcome or the results. Okay. So probably that is why probably a psychiatry is a very potential areas, especially the severe mental disorders is a very potential candidate for the integrative medicine.
Thank you so much, sir. So there is another question, sir.
Yeah.
So in our Samhidas, for some diseases, we have Nidana as Purvajanma Krita Papa. What is your opinion about this, sir?
See, I think there are, I would like to have, or I like to give you two personal perspective of how we could understand as a practitioners, or especially the students or the scientists of the modern generation. Because when we use such terms, no, people always think that Ayurveda is very old, very ancient, and very philosophical. And but if you can understand, no, what exactly we should understand by this Purvajanma Krita Papa karmas. See, basically, the karmas can be Ihajanmani karmas and Paurvadaika karmas. So the acts that we do at this Janma and the acts probably which has happened in the Purvajanma. But if you talk like a scientist, or if you want me to give what could be understood as this, what the Purvajanma Krita Papa karmas analysis is, see, if you go to the modern pathology or modern textbooks for most of the diseases, and if you look for the exact pathology, we always read that the causes is not known. Causes is idiopathic. Okay, probably Purvajanma also sometimes we could perceive that it could be, it is, if it is just synonyms with saying that the reasons are not known by the human nature and the exact cause cannot be suspected. That is one answer, that you can consider this Purvajanma as idiopathic. The second is the Purvajanma. See, when we say Janma, it is a birth, and that all those incidences that happens before the birth, like for example, the pre-conception period, the conception period, and the pregnancy period also could be considered as the Purvajanma. Any insult that can happen during this particular period, that is why they generally say the golden 1,000 years of a child development. It starts 6 years before the conception and it extends to the 2 years of the child. And whatever happens during this particular period can play like a foundation component for the physical, social, psychological development of a child. And that is what you can just consider all those events before the birth, which can be traceable as the Purvajanma. And if you go a little beyond, probably accept the concept or accept the principles of Purva Janma, definitely it talks about the life beyond that. Okay. So these are the three basic understanding which I can think of, and whichever suits you or whichever you could accept, you can take it up and probably further explore in this particular area of psychology.
Thank you so much, sir. So there is another question about Purva Janma Krita Karma, sir.
Yeah.
Sir, how can we understand Purva Janma Krita Karma? What included in it? Like if aharaja reasons, we consider something unhygienic food ate by the person. But how we see Purva Janma Krita Karma now? Because we are unable to go Purva Janma of anyone, then how we understand Purva Janma Krita Karmas?
I think I briefly have answered this question previously. Okay. To add to that, see, so it is not that we cannot go to the level of going to the previous Janma, and we cannot, it is not that we cannot find out what exactly happened in the previous Janma. There are some specialized techniques which can be used and which also are practiced in the psychological or the applied or clinical psychology. And even sometimes we also use these techniques in some cases where we are trying to see the exact cause of the patients. See, there is something called as the age regression therapy, where we are trying to go cells the birth and sometimes go beyond that and try to see whether a person has any thing that is there in his unconscious mind or the preconscious mind about incidents which he links to that particular, like for example, a patient has pain in the leg and probably he might have hit somebody with his leg and some knowing or unknowing, maybe this Janma or Purva Janma, and then he probably realizes that he has probably hit someone or he has hit someone, and then now he is suffering that. And when he realizes that and make the prayashita for this and surrenders himself for that, he gets really better. Okay. So definitely there are some specialized techniques, but as I said, you need specialty practices, use this under the training of a specialist, and then you can definitely use such techniques.
Sir, there is a final question, sir. So how to connect genetic disorders and psychosomatic disorders, sir?
Connect or correct? Correct. Yeah.
Oh, sorry, correct. Sorry, sir.
See, basically, you should understand, see, that is why Ayurveda always has specified that the pregnancy is not an act by chance. It's a planned phenomena, and that is why it has been given the status of a samskara, Garbhadana samskara, which is the first samskara, and this is a state. That is why the Bija Shuddhi and Garbha Shuddhi should be done before a person is getting into conception. And if at all you see that there is some family history of some genetic disorders, or there's a family history of some psychosomatic disorders, or there's a family history of some psychiatric disorders, it is better that you undergo the process of Shodhana, especially the Panchakarma, then follow all the process that has been mentioned. Like now, there are some specific indications or specific modalities of treatment for the male partner. Like one should use the Grita, Kshira, etc. And female should use the Tila, Taila, etc. And then a person should abstain themselves for 1 month and then probably plan for a progeny. And that too, if a person feels that there is some genetic or congenital anomalies in the family related with some soft organs, maybe like kidney, heart, etc., then you see that it is mainly because of the Matrija Bhavas. And that is why probably focusing more on the female partner is very important. And suppose if you feel that there is something like a spina bifida or some problem with the hard organs or the organs which are katina in nature, then you feel that it is because of the Pitrija Bhavas. And that is where you need to address the male partner at large. And when you can do that and probably follow all the samskaras and at the same time follow very meticulously the Masanumasika Garbha Paricharya, Garbhini Paricharya, and follow all the techniques told in the Sutika Paricharya, probably many of these genetic disorders can be preventable. And that is why, like, especially Sagotra Vivaha, etc., should be prevented. Consanguineous marriage should be prevented. And there are definitely like Garbhopakata bhavas, just mentioned, the Balabhardikara bhavas, the Sharira Vidyakara bhavas. All this definitely, if you can bring into practice logically, it can definitely help in reducing the patient's problem. I think it's 7:30. I think Shavantika, if you could,
Yes, sir. Yes, sir.
and
Dear
if
delegates,
I can
please
just
note.
share my email ID, and if
Sure, sir.
more questions, probably you can pass on to me, and I'll be happy to answer this. I can also share my phone number, and if anyone wants any help in the management and treatment of mental disorders, you're most welcome to contact me. I'll be very happy to help.
Thank you so much, sir. Thank you.
Thank the organizers for these wonderful opportunities. Thank you very much.
Thank you so much, sir, for patiently answering all the questions, sir.
Now, to deliver the vote of thanks, I would like to invite Dr. Tulya Mohandas, Vice Principal, Ayurveda College, Coimbatore. Over to you, ma'am.
I am very fortunate to extend my vote of thanks to my guru, Dr. Suhas Shetty sir, for giving his valuable time and treasure of knowledge with us. Thank you, sir.
Thank you, Dr. Tulya. Thank you, the entire team of SAMSIDDHI. Wish you all the best.
Thank you so much, ma'am. With that, we conclude today's first session. I would like to request the participants not to leave the room as we resume the second session as soon as possible. Good evening, sir. Good evening, sir. Dr. Prashanth Kumar, sir. Good evening, sir.
Good evening.
Good evening, sir. Can you hear me, sir?
Yeah, definitely. Yes.
Sir, we are students of Ayurveda College, Coimbatore, sir. We will be your anchors today, sir.
Sorry?
Sir, we are students of Ayurveda College, Coimbatore, sir. We will be your anchors today, sir.
Okay, welcome. Please. Please continue.
Yes, sir. Will you be sharing any PPT with us, sir? Will you be sharing any presentation with us, sir?
Yeah. I have my presentation. So,
could you please try screen sharing, sir?
Yeah, I have my presentation.
Okay, sir. Okay, sir.
May I start?
No, we will be having a welcome address and an introduction for you, sir.
Okay.
And then we will hand over the session to you, sir.
I shall share my screen. I have one presentation with me that I shall share.
Okay, sir. Thank you so much, sir. Shall we begin, sir? It's already 7:33, sir.
Yeah.
Thank
Please
you,
start.
sir. Thank you, sir. Welcome back, everyone. Now, for the second session, it's my great honor to welcome Dr. Prashanth Kumar, sir, to present on the topic Recent Research Advancements in Rasa Shastra. Now, to render the welcome address, I would like to welcome Dr. Tulya Mohandas, Vice Principal, Ayurveda College, Coimbatore. Over to you, ma'am. Okay, sir. She'll be here with us.
Good evening, everyone. Hello.
Yes, ma'am. We can hear you, ma'am.
Can I deliver the welcome speech?
Yes, ma'am. Yes, ma'am. Over to you, ma'am.
There were some technical issues, so that is the problem.
Okay.
Okay, good evening, everyone. It's my honor to welcome. No,
Ma'am, we can hear you, ma'am. Hello, ma'am. We can hear you, ma'am. Please continue, ma'am.
hello.
Yes, ma'am. We can hear you, ma'am. Please continue, ma'am.
Okay. It's my honor to welcome Dr. Prashant sir in today's session. I am welcoming sir and welcoming all the participants who are gathered here for today's session. Thank you.
Thank you so much, ma'am.
Before handing over the session, I would like to take the privilege of introducing Dr. Prasandra Kumar Sarkar. Sir completed his graduation from J.B. Roy State Ayurvedic Medical College and Hospital, West Bengal, post-graduation in Rasashastra and PhD from Institute of Postgraduate Teaching and Research in Ayurveda, Gujarat Ayurveda University, Jamnagar, Gujarat. At present, he is working as professor and head of the Department of Rasashastra, J.B. Roy State Ayurvedic Medical College and Hospital, Kolkata, West Bengal. He has more than 13 years of teaching experience and 9 years of administrative experience. He has 46 articles publication in national and international journals, 1 book and 2 book chapters in his credit. He is 2 times recipient of Best Research Awards from Indian Drugs Manufacturing Association in the year 2007 and 2011. He has research interest on characterization and evaluation of nanoparticles in plasma, searching for solution of heavy metals and arsenic hazards, and Ayurvedic drug design and development for various diseases. It's an honor to have you here, sir. Now, without any further ado, let me hand over the session to Dr. Prasandra Kumar Sarkar. Over to you.
Thank you. Thank you very much. And thank you for a nice introduction. Good evening to all. Research trained in Rasashastra. So why Rasashastra? Because Rasashastra or Astrology, these are the one of the very good component for drug research nowadays. Actually, we may seen that most of the drug research nowadays are carried out on medicinal plants, but few research also carried out on Rasashastra also. But I think in near future, Rasashastra will get the most importance regarding drug research. Why? Because of the phospho mostly. We know the phospho, those are nothing but the biologically produced nanoparticles, and due to its very small particle size, nowadays this phospho, this got attention of the scientists, not only from the Ayurveda but also the modern fraternity. So why? Because you know that the nanoparticles, the meta nanoparticles, those are only stable in solid form, in phospho form only. In modern science, they also produce the meta nanoparticles, but for their stability, they have to use some liquid media. But in Ayurveda, we can dispense, we can prepare the nanoparticles in solid form. So for this reasons only, the Rasashastra, the phospho particularly, those got attention from the scientists, both from the modern as well as the Ayurvedic fraternity. So I have a presentation here. I'd like to share the presentation. Yeah, current research trend in Rasashastra. Just I told that why research in Rasashastra is so important. Just I would like to take a look what the research nowadays carried out on Rasashastra. Those are preparation and characterization. We know that for one single preparation of Rasashastra, so many hundreds of methods mentioned in our text. So the scholars of Rashastra, those are trying to prepare the Rashashodhi by adopting various methods, and then after preparation, characterization of the prepared Rashashodhis are carried out. Then in vivo activities studies. In previous days, if I can recall properly, just 10 years before, mostly the antimicrobial studies of the prepared Rashashodhis mostly carried out, but nowadays the in vitro toxicity study in cell lines as well as cell line anti-cancer study are also carried out by taking this Rashashodhi. Then preparation and toxicology study. I can say that the toxicity study of almost all the Rashashodhi has been carried out, and also works are going on, and the results are also very interesting. We can find that most of the Rashashodhi, those in the therapeutic as well as at higher dose, are having no toxicity, no acute as well as chronic toxicity. Then preparation and various animal pharmacology study. Here also various studies have been carried out specifically in the field of anti-diabetic study, anti-hyperlipidemic study, antioxidant study, anti-inflammatory study, as well as nowadays particularly antiviral study as well as anti-cancer study, anti-tumor studies are going on various Rashashodhi. Then preparation and clinical trial. Although the scholars of Rashastra, those are giving clinical trial of various Rashashodhi, but in this field we are lacking. Just I shall discuss that in which particular field we are lacking, but we are seriously lacking in this particular field in clinical trial of Rashastra. Then preparation and application for new indication. Yeah, like for indication of Rashashodhi for the treatment of cancer, for the treatment of AIDS, and now in this pandemic situation for the treatment of COVID, we can apply. The application are going on, and then results are very interesting. Then post-market surveillance study. This is quite new. Just only one thesis I think have been carried out from the All India Institute of Ayurveda, New Delhi, and that was carried out by Dr. Niladri Bhattacharya on post-market surveillance study of Saskutar Rosh. Actually, this particular field has enormous opportunity, because what are the acceptance and what are the adverse effect may occur of the classical as well as newly prepared Rashashodhi, we have to know, and for that purpose we have to perform this post-market surveillance study. Then study on adverse effect and management. In Rashastra, various toxic elements are used as therapeutic entity, and the possible adverse effect, if those are not prepared properly, if those are prescribed in overdose and longer duration, then those may create adverse effect. And the management of those possible adverse effects are also mentioned in our text. Those particular adverse effect and management we can take as our research activities. Like iron overloading in thalassemia patient. In our text, the possible adverse effect of iron, of low, it is mentioned, and the management also given in our text. That particular management we can take nowadays for the treatment of the iron overloading in the patients of thalassemia. Like that, we'll discuss in detail. Okay, I'm coming one by one. First, preparation. Nowadays, as research for preparation of Rashashodhi, we are mainly trying to validate the process. Actually, process validation, it is the final terminology of the process standardization. Actually, we particularly want to standardize right from the collection of the raw material until the dispense of the Rashashodhi to the patient, and everything comes under the process validation. How it should be collected, how the method should be done, all comes under process validation. Then development of SOPs. that is also very important. The particular temperature pattern and the duration of trituration, duration of heating, all comes under the standard operative procedures. And the second two, these are the determination of temperature pattern and duration and process of trituration. These are given most importance. Just I am given, just I want to give some example. Temperature pattern. I just want to take example of preparation of Tamra Bhashma. Tamra, when it is heated in presence of extra sulfur, then cupric sulfide is formed. The cupric sulfide, it is unstable sulfide of copper. When it comes in contact with atmospheric oxygen, then copper sulfate is formed, and the copper sulfate is toxic to our body. So if we give temperature to the Tamra Bhasma below 450 degrees centigrade, then the sulfur, it remains in liquid form, and at that particular temperature there may be every possibility of formation of cupric sulfide. But if copper is heated in vapor of sulfur, then cuprous sulfide is formed. And this cuprous sulfide, it is the stable sulfide of copper, and it is completely non-toxic. So if we prepare Tamra Bhasma above 450 degrees centigrade to 800 degree centigrade temperature, then the prepared Tamra Bhasma will be proper. Again, I want to take the example of preparation of Rashakorpur. Rashakorpur, we all know it is one Kuipaka Rashan, Nirgandha Kuipaka Rashan. Here it is prepared by reacting mercury with concentrated sulfuric acid, and then it is mixed with the rock salt, and after that Kuipaka Rashan, it is prepared by the method of Kuipaka Rashan. And by this way, the AgCl2 is formed. It is highly corrosive, but it is excellent medicine for the treatment of various skin diseases, particularly ectogusta, psoriasis. And the beauty of the preparation of Rashakorpur is, Rashakorpur, it is formed at the temperature of 270 degrees centigrade, and it dissociates at the temperature of 320 degrees centigrade. So during preparation of Rashakorpur, the temperature pattern, it should be fixed at 300 degrees centigrade. If it goes beyond 320 degrees centigrade, then it decomposes. And if the temperature is below 270 degrees centigrade, then it doesn't form. So it is the beauty of specific temperature pattern during preparation of Rasasodi. So determination of temperature pattern is very, very important. And then duration and process of trituration. The particle size of the Rasasodi, it is very, very, very important for its specific biological effect. And the particle size, it depends on the process of Bhavna. So, the particular rotation and the pressure given during Bhavna, during trituration, it is very, very important. So, I'm coming to preparation. This is the method of, actually it is mechanical Bhavna in end runner. Here we can fix the rotation as well as the pressure, and this is the temperature in muffle furnace for preparation of Bhasma. Here we can regulate the temperature, and nowadays for preparation of Kuipaka Rashan and preparation of Bhasma, almost the temperature pattern almost have been fixed for all the preparation. Yeah, this is example of the temperature pattern input. This is the temperature pattern in Gajaput, and this is the temperature pattern of Badahput. See, in both the cases, the highest temperature, it almost reaches to 900 degrees centigrade. See, but in case of Gajaput, the highest temperature, it remains almost for 1 hour. But in case of Badahput, it remains only half an hour. So the materials, those are harder. We can adopt Gajaput for those, and for the softer material, we can adopt the Badahput. And for that reasons, for preparation of Tamra Bhasma, for preparation of Loha Bhasma, Gajaput is given, and for preparation of Nag Bhasma, for preparation of Jasad Bhasma, for preparation of Banga Bhasma, Badahput is mainly mentioned. Yeah, next I'm coming to characterization. Before actually 1995, for characterization of Raussodi, we mainly adopt the Lawson drying, as value, acid insoluble as, sulfated as, and we go for the analysis of the chemical present in the prepared phospho. For those purpose, we generally adopt the quality analysis as well as UV visible spectrophotometer. Those are also very important because by the acid solubility we can assess what are the biological activities of the prepared phospho preparation. But after 1995, I can say almost after 2000, we adopt the sophisticated analytical tools for characterize the phospho preparation. Like, to know the particular chemical composition of a phospho preparation, we generally adopt the atomic absorption spectrophotometer or atomic emission spectrophotometer with inductively coupled plasma. By those analysis, we may know what are the particular chemicals present in a phospho. Like for example, low phospho, it should contain the iron, it should contain manganese and others, oxide and others. Then particular chemical compound analysis, which particular chemical compound is present in the prepared phospho preparation, and for that purpose we have to adopt the X-ray diffraction method, X-ray fluorescence method, and by adopting these tools we may know that the prepared low phospho may contain the ferric oxide, ferrous oxide, ferrosulfuric oxide, ferrous sulfide and others. Then the analysis of specific bond present in the prepared phospho or prepared Raussodi. In Rashastra, we generally claim that the prepared phospho are the nothing but those are the Shendriya material. During the preparation, we make the metal mineral into harbometallic or harbomineral form, and we have given the terminology Shendriya. And for that purpose, we have to analyze the particular organic material present in the prepared phospho. And for that purpose, we have to adopt the FTIR analysis, EDEX analysis, and Raman spectroscopy analysis. This Raman spectroscopy analysis, it has beauty that we can by using this tool we can analyze the presence of phospho in the biological cell also. Then anatomy of the prepared phospho. Here anatomy means the shape and size of the particle, and for this reason we have to adopt the SCM or TM analysis, scanning electron microscopy or transmission electron microscopy, and by adopting this tool we can know the specific shape and size of the particles. Not only the size of the particle, the particular shape of the particle is also very important for the specific biological activities of one particle. Like one spherical nanoparticle, it has more viability than nanoparticle of other shape. So we have to know what are the particular anatomy of the prepared phospho preparation. Then particle size analysis. This is the most important among all these analysis, and for this purpose we have to adopt the electron microscopy analysis like SEM, TEM. XRD also gives some idea regarding the particle size, as well as we can adopt directly the particle size analyzer to detect the particle size of the prepared phospho preparation. Yeah, these are the example of analysis of compound present in the prepared phospho. This is the X-ray diffraction analysis of tamra phospho. See, you can't see, but all the peaks those are of cupric sulfide. So this particular graph of XRD pattern of tamra phospho, it indicates that this prepared tamra phospho, it needs amritikaran, because here the cupric sulfide is formed. We have to convert this cupric sulfide into cuprous sulfide. So during amritikaran procedure, when tamra phospho it is again heated with extra sulfur, then this cupric sulfide, it will be transformed to cuprous sulfide. So this is the XRD analysis of Tamra Bhasma. This is the FTR analysis of low Bhasma. See, this particular angle, this indicates the presence of specific bond. This is the OH bond present in the prepared low Bhasma. This is the CO bond present in the low Bhasma. This is the FeO bond. So by presence of this carbon, we can claim that organic material is also present in the prepared low Bhasma. Then only we can claim that our prepared Bhasma are nothing but Sendriya. Those are carbometallic or carbomineral in form. And these are the microscopy. This is the ACM analysis, scanning electron microscopy analysis of Abhra Bhasma. And this is the transmission electron microscopy of Nag Bhasma. These are the spherical nanoparticles, and these are this is 250 nanometer length. And see, this is the size of the particle. It will be only 30 nanometer. So by this analysis, we can claim that our prepared Bhasma are remain in nanoparticle form, and the particles, those are mostly spherical nanoparticles. As I told that the spherical nanoparticles have the most viability among all the nanoparticles. This is the Raman spectrophotometry analysis of Jasad Bhasma. By Raman spectroscopy analysis, we can assess the presence of Bhasma even in the biological system. These are the analysis Raman spectroscopy intensity in the cell of Jasad Bhasma during treatment of for evaluation of its anti-diabetic effect. So nowadays, most of the scholars, those are adopting this Raman spectroscopy analysis to ensure the presence of the prepared Bhasma in the biological system, inside the cell. Now coming to the in vitro activity studies. As I told that previously, mostly the antimicrobial study of the prepared Bhasma, those are carried out, specifically the antibacterial study. I can recall the work of Dr. Tambekar. He has reported antibacterial effect of low Bhasma, Tamra Bhasma, Kasis Bhasma, and others. And as I recall, under Shobhaji Hiravat Madam, some works are also carried out of Rashok Bhasma, antimicrobial study of Rashok Bhasma. And all this study, those are reported that all this Bhasma preparation means Tamra Bhasma, low Bhasma, Rashok Bhasma, as well as Rashomanikko, Shuddho, Gandhak, those are having very significant antibacterial effect against staphylococcal bacteria, streptococcal bacteria, even E. coli. Then nowadays, for the toxicity study, in vitro toxicity study also carried out. Those are mainly carried out in the human active human cell, and it is seen whether the prepared Bhasma it causes the cell apoptosis or not of the normal cell. If it doesn't cause any cell apoptosis, then it is claimed that the Bhasma or prepared Bhasma has no toxicity. And then the cell line study. The cell line study is mainly carried out to know whether the particular Bhasma preparation it is having anti-cancer effect or not. And for to know the anti-cancer effect, the cell line of breast cancer, cell line of ovarian cancer, cell line of lymphoma, cell line of various blood cancer, all are available. So by adopting this tool, we can in vitro we can know whether the specific activity is present in the prepared Bhasma or not. Yeah, these are some works. As I told that the antibacterial study of this Bhasma, those are already reported. That is Rajat Bhasma, Tamra Bhasma, Loh Bhasma, Rashok Bhasma, Rasomanikko, Shuddha, Gandhak. And all the studies reported that all these preparation have very good antibacterial effect. This is some reported in vitro toxicity studies on human normal cell line, Swarnobhashmo, Hirokbhashmo, Rasomanikko. And among these three, the studies on Hirokbhashmo and Rasomanikko, this is particularly performed of a team from Kolkata, and I'm also one of the member of this team. And it is the study report; those are already published, and the report those are reported that the Hirokbhashmo Rasomanikko, those are completely non-toxic in vitro toxicity study. Then anti-cancer cell line study. That is carried out on Swarnobhashmo, Hirokbhashmo, and Rasomanikko. And among those, the Rasomanikko, it is reported it is very good anti-cancer effect on human breast cancer cell line. Hirokbhashmo, it has very good anti-cancer effect on breast cancer as well as lymphoma. And Swarnobhashmo, it has very good anti-cancer effect over ovarian as well as breast cancer cell. Yeah, these are some pictures of in vitro studies. It is antimicrobial study of Rajat-Bhashmo. See the zone of inhibition. It shows the antimicrobial effect over the Bacillus subtilis, Staphylococcus aureus, Pseudomonas aeruginosa, Klebsiella, as well as Aspergillus niger. So Rajat-Bhashmo has very good antimicrobial effect over the bacteria as well as fungus. And this is the study of anti-cancer cell line and study of cancer cell line of Swarnobhashmo. This particular white dots, these particular white dots inside the human breast cancer cell, it shows that the low phosphate enters inside the cell and it causes destruction of the cell. It causes the apoptosis of the cell. So this particular picture, it indicates the anti-cancer effect of Swarnobhashmo. So nowadays these are very important to know before in vivo study, before the study inside the body, we can know whether the effect is present in the Bhashmo or not by adopting this in vitro studies. But there are some challenges in this in vitro studies. What are those challenges? First is solubility. Most of the studies, those are most of the Bhashmo, those are insoluble in water. But for the DIKSHA preparation for antibacterial study, the solubility of the material is needed. If the material remains in solid form during this antimicrobial study, it may cause destruction of the cell. So it is one of the challenges before us, that how this Bhashmo preparation it will be soluble in the intermedia, and the proper DIKSHA should be prepared. Will be prepared. And another is dose. These studies, these are carried out in minimum dose, and the dose of the Rosodi are also minimum. So what will the specific dose for carried out these specific studies? These are another one challenges before us. So we have to overcome these challenges to get a particular effect of in vitro studies of Rosodis. Then I am coming to the toxicology studies. As I told that the toxicity studies of almost all the Rosodis have been carried out. Why? Because we know that although Rosodi are most effective, but those are biased too. Because as therapeutic entity, we use arsenic, we use mercury, we use lead as therapeutic entities. So we have to establish the safety of those preparation. That's why, first of all, we carried out the toxicology studies of the Rosodi. And for those, the acute toxicity, subacute toxicity, and chronic toxicity are mostly carried out. And nowadays, the dermal toxicity, genotoxicity, carcinogenicity, as well as teratogenicity of the Rosodi are also reported. Coming to the result, it is found that most of the cases, no acute, subacute, and chronic toxicity are found of the Rosodi. Yeah, for the preparation of mercury as well as lead, and arsenic too. Here, at previous times, we generally adopt the therapeutic dose 5 times, 10 times, 20 times, 40 times, up to 80 times for the acute toxicity study. But nowadays we follow the international guidelines like OECD guidelines, and for those purpose we have to follow only 4 groups of 5, 50, 200, and 2000 md per kg dose, and 3 animals should be taken in each group, and then we have to see whether it produces any type of toxicity or not in acute toxicity. For chronic toxicity, we have to continue the study for 90 days. Then we may again continue the study for another 30 days to know whether it has any effect during the recovery period also. And these chronic toxicity studies generally carried out in 3 different doses, like therapeutic dose 5 times as well as 10 times than therapeutic dose. In almost all the cases, no acute, subacute, or chronic toxicity is found in the Rasasodi, but not in all the cases. Yes, not in all the cases, because some toxicity are reported like for Rasamanikko, Shuddha Harital and Rasamanikko. If the Shuddha Harital and Rasamanikko it is given without any Unupan, then it may cause degenerative as well as fatty changes in liver. Tamra Bhasma also, if at 10 times more than therapeutic dose, it may cause degenerative changes in liver as well as in testis. As well as dermal toxicity of Nag Bhasma is also reported by Dr. Dabe. It is carried out at IPGT and RA Jamnagar. So in therapeutic dose, most of the also those are safe with particular Unupan. But at higher dose, it may cause toxicity if it is not prepared properly. But in most of the cases, those are almost safe. Yeah, these are some result of the studies. These are the some histopathology of low Bhasma. See, there is no pathology in the liver section of all the slides. This is the histopathology spleen of study of Shuddha Kasis and Kasis Bhasma. Here also there is no toxicity we can find, and this is the genotoxicity of Tamra Bhasma. Genotoxicity of Tamra Bhasma, genotoxicity of Abra Bhasma, those are also reported. And again, there is no genotoxicity of Abra Bhasma and Tamra Bhasma was found. So you can say the properly prepared also, so they are almost safe. Now I am coming to the pharmacology studies. In this particular field also, we are already have done so many studies, and in this particular field, I may take one name as pioneer is nothing but Dr. B. Ravisankar sir. Previously, he was head of Department of Pharmacology, IPGT RA, Gujarat Ayurveda University, Jamnagar, and under his guidance, so many studies have been carried out on the Rasasodi, and mostly the anti-diabetic studies, anti-inflammatory studies, immunomodulator studies, antioxidant, spermatogenic effect, analgesic and antipyretic studies, anti-hyperlipidemic studies, hematinic activities, and nowadays anti-tumor and anti-cancer studies are going on. I'm coming one by one. First, anti-diabetic studies. This is I can say the mostly carried out studies of the Rasasodi. The anti-diabetic effect of so many Rasasodis are already reported, like Makaradhwaj, Nag Bhasma, Banga Bhasma, Jashad Bhasma, Abhrag Bhasma. And one thing I would like to share with you that one study carried out by Dr. Pavin Tate on Nag Bhasma. Here the streptozotocin is used for induce diabetes in rats. This streptozotocin, it causes complete destruction of the beta cell. So it produces diabetes. So when Nag Bhasma is prescribed to Nag Bhasma is given to rat, it it leads to blood glucose level to almost normal level. But when the drug stopped, even after 30 days of stopping Nagbhasmo, it is found that the blood glucose level of the rats, it remain in the normal level. So here it may be concluded that the Nagbhasmo, it has beta cell regeneration capacity. Otherwise, it is not possible to remain the blood glucose level in normal level after 30 days after stopping of the medication. So we have to do the study further, and we have huge opportunities of these Raushadhi as therapeutic entity. Antioxidant studies. We know that the Rashan, it is one of the common pharmacological properties of almost all the Raushadhis. So this particular Rashan effect we can evaluate by the antioxidant study, by the immunomodulator study. So here Rasasindur, Swarna Bhasmo, Abhrug Bhasmo, Tamra Bhasmo, Loh Bhasmo, almost all the Bhasmo, those showed very good antioxidant effect. Then anti-inflammatory studies, Swarna Bhasmo, Tamra Bhasmo, Shukti Bhasmo, those are exhibited very good anti-inflammatory effect. Here one beauty is there. This particular like Swarna Bhasmo. Swarna Bhasmo, actually it is very good immunogenic agent. So it is very good immunostimulant. It can stimulate the dendritic cell. That's why it exhibits the phagocytic effect, and thus it shows shows very good immunostimulant effect. At the same time, Tamra Bhasmo, it has anti-inflammatory effect. Like nowadays, we generally have heard one term that is cytokine expression in the patients of COVID. And in particular, in that particular situation, this Tamra Bhasmo, it will be very, very effective to control, to reduce the cytokines level. So these are very, very effective as anti-inflammatory agent. Then immunomodulatory studies, Swarna Bhasmo, Yashod Bhasmo, Abhrug Bhasmo, all are having very good immunomodulatory effect. Analgesic effect, Swarna Bhasmo, Rajat Bhasmo, Shukti Bhasmo, these are effective in almost all type of analgesic studies, like thermal analgesic effect as well as electric analgesic effect. Is in almost all models, those are effective. Anti-hyperlipidemic studies, Rajat Bhasmo, Tamra Bhasmo, Maxic Bhasmo, these are effective in the high lipid diet, hyperlipidemia in rats. Hematinic effect, Low Bhasmo, Mandur Bhasmo, Maxic Bhasmo, Shuddha Kasis, Kasis Bhasmo, all are effective. And among these, I have studied on Low Bhasmo and Mandur Bhasmo, and I found that these are very, very effective as hematinic agent in the HgCl2 induced iron deficiency anemia in rats. Anti-cancer effect, as I told, that Swarna Bhasmo, Manikko Bhasmo, Hirok Bhasmo, Rashomanikko, those are effective as anti-cancer effect. Here, cancer, it is produced in the biopsy mice. That is breast cancer, and it is found that the Hirok Bhasmo and Rashomanikko, those are very, very effective to reduce the tumor in the biopsy mice. Yeah, these are the results. We generally follow the reverse pharmacology approach to decide mainly the dose. In case of modern science, they decide the new chemical entity by various animal studies, by evaluating the LD50 value, evaluating the AD50 value. But in case of Ayurveda, our task is very easy, because here the human dose is already mentioned. We have to only extrapolate the human dose to the animal dose. So here we mainly follow the reverse pharmacology approach. Most of the cases, significant results are reported. As I told that for almost all the studies, means the anti-diabetic effect of Nagbhasmo, anti-hyperlipidemic effect of Tamravasmo, the significant results are reported. But the activity depends on method of preparation also. For example, just I told that Tamravasmo, it has very good anti-hyperlipidemic effect. And it is reported when the Tamravasmo is prepared by using the plant drugs, it shows better result as anti-hyperlipidemic agent in comparison to the Tamravasmo when it is prepared by using sulfur as Marakdrapa. So the effect of the phosphate depends on the method of preparation too. It also the activities also depend on the Anupan. It is reported in the studies of Rashomanikko that when it is given without vehicle, without Anupan to the animal, then it may cause degenerative effect and fatigue. It's Anupan, then it doesn't cause any type of adverse effect in animal. So the particular method of preparation as well as one, it is very important dispensing of the Rasosodi. Now I am coming to the clinical studies. Various clinical studies have already been carried out, mostly on Solo as Bajikaran. Yeah, these are some also the effective on diabetes mellitus, Madhumeho. Those are Nagbhasmo, Bangabhasmo, Jasadbhasmo, Tribangabhasmo, Abragbhasmo, Shuddha Jotu. All bhasmos are reported are having very good anti-diabetic effect in the patients. Then in the patients of Grahani, Rashaporpoti, Tamravhasmo, Shankhabhasmo, all are reported are very good effect against patients of Grahani. Amlopitto, Abragbhasmo, Muktabhasmo, Pravalbhasmo, Shankhabhasmo, Shukti sorry. All are having very good Amlopitto haro effect in patients. In Kushthodog, Rasagorpur, Nagbhasmo, Gandhagrasan, Shuddharital, Rasamanikko, all are having very good effect on the skin diseases. And among those, Gandhagrasan and Rasamanikko, those are having Kushtaharo effect as internal agent, and Rasakorpur, Shuddharital, Rasakorpur, it is mainly effective as external application. Pandurog, iron deficiency anemia, low bhasmo, Mandur bhasmo, Makshik bhasmo, Shuddha Kasis bhasmo, those are very good. Those are having very good Pandu haro effect. And here I would like to say that low bhasmo, Mandur bhasmo, those are having better effect than ferrous sulfate tablet for the treatment of Pandurog in the patients. Then Swasrog, breathing difficulty, bronchial asthma, in this case, Rasasindhu, Tamravhasmo, Abragbhasmo, all are very, very effective in the patients of Swasrog. Solo, yeah. Tamravhasmo, Makshik bhasmo, Shuddha Jotu, and for others also the Soloro effect in the patients, those are carried out. But in this case, almost in all the study, the placebo group, those are given better result than the drug group. So in this case, it may be inferred that the drug has very little effect for the treatment of soul. Yeah, Bajikaran. So many drugs are evaluated as spermatogenic effect in the patient, like Makarodhaj, Sharnabhasmo, Bangabhasmo, Sharnabhasmo, Abragbhasmo, Shuddha Jotu, and all the medicine, those are exhibited very good spermatogenic effect in patients. And these are the results. Highly significant results are reported for almost all the studies. And the most important thing that no adverse reaction is reported. can take example of low Bhasmo, Mondur Bhasmo in comparison to ferrous sulfate, because that particular study I've carried out. And in that particular study, I reported that the ferrous sulfate tablet, it causes constipation, it causes abdominal discomfort, abdominal cramp, but no such effect it exhibited by low Bhasmo and Mondur Bhasmo. So no adverse reaction of the Rososodhya reported during the clinical trial. These are some limitations. As I told, that our clinical studies are not up to the mark. Why? Because we generally take less number of individual. For example, 10, 30, highest I may say almost up to 100. But this is not up to the mark. If we only carried out the phase 2 clinical trial, we have to take minimum 200 cases per group, 200 individual per group. So this is one of the limitations, that less number of individual. Next, we generally do our clinical studies by a fixed dose. But for a better clinical trial, you have to go for the dose dependent studies. We have to do our studies at the therapeutic dose, at higher dose. Then only we can claim that that drug is effective in that particular dose without any adverse effect. And another thing is, we don't use the proper control studies. For a good clinical trial, it should be double-blind, randomized, control clinical trial. It may be negative control or it may be a positive control. Negative control, it indicates the placebo control study, and positive control, it indicates the study with using standard drug. According to ICMR guidelines, we cannot use placebo in all the cases. Like for clinical trial on the patients of diabetes mellitus, Mudhumeha, we cannot use the placebo. But for the study on patients of Solo, we use placebo. So for a proper clinical trial, we have to go phase-wise clinical trial. We can go for phase 1 and phase 2 clinical trial. In phase 1 clinical trial, we have to take the healthy volunteers, minimum 20 healthy volunteers, to know whether the specific Rososodhi, it causes any type of toxicity or not, any type of adverse effect or not. And then phase 2 clinical trial, here we can take minimum 200 patients. And in those patients, we have to determine when the particular Rososodhi is effective or not. So those are needed. That's why our clinical studies, those are not accepted by the highly reputed journals due to those limitations. Yeah, these are some opportunities. Application for new indications. We all know now, in this particular situation, in this COVID situation, treatment of COVID is needed by any drugs. The modern drugs almost failed in this particular situation. Here we can raise the Ayurvedic science for treatment of this particular situation. And these particular cases Rososodhi may help us most. Here I have taken one example, that arsenic preparation for the treatment of cancer. Arsenic, it has very good bone regeneration capacity. So at previous days, arsenic preparation, those were used for the treatment of bone cancer, but it was stopped due to its toxicity. But in Ayurveda science, we use arsenic as non-toxic agent, as therapeutic entity. So here we can use different arsenic preparation for the treatment of cancer. Then management of adverse effect. As I told, that in Rosastra we use various toxic material like arsenic, lead, mercury. In our text, the possible adverse effects are mentioned, and what will be the management of those adverse effects are also mentioned. So those we can take as lead. For example, arsenic toxicity due to subsoil water. It is one of the major problem in the Gangetic belt, like in some part of UP, some part of Bihar, as well as in Bengal and Bangladesh. The particular management mentioned in our text for the arsenic preparation, we can use as drug for the treatment of the arsenic poisoning patient. So here we can take lead from the management of the adverse effect. Then characterization and application of nanoparticles. All types of nanoparticles are not equally effective. As I told that the spherical nanoparticles are have better effect than the other separate nanoparticles. So here from the prepared Phosmo, because those remain in solid state, we can separate the particles of different sizes. And then we can apply those specific separated nanoparticles for particular diseases. One such studies presently was reported from USA. In that specific studies, what they did, they separate the spherical nanoparticle from Sornobhasmo, and then they have used for those particular spherical nanoparticle from Sornobhasmo for the treatment of cancer. And those nanoparticles exhibited excellent result for the treatment of cancer. So we may adopt this type of studies also. New antibiotics we can get from the Rhaosodhi. Just few days back, one specific antibiotic from arsenic was reported. The name of the antibiotic is arsenothrocin. This arsenothrocin, it is effective particularly over the multi-drug resistance bacteria. So we can give the trial of different arsenic preparation as new antibiotics. So these are the opportunities before us regarding use of various Rhaosodhis for different purposes. Yeah, this particular diagram, this I have just published in one journal regarding treatment and activities of Ayurvedic metal nanoparticles, Ayurvedic Bhasma preparation to prevent COVID. Here, I have shown that the low Bhasma and Sorno Bhasma, this can be effective over the spike protein. The Joshod Bhasma and Rajod Bhasma, it can particularly effective, it can particularly prevent the replication of the virus. And the Tamra Bhasma and Rajod Bhasma, it can again prevent the maturation of the virus by preventing the M protein, the membrane protein. So this is only the theoretical thing. We have to prove by various studies that the Ayurvedic phosphor preparation, these have antiviral effect, that this can prevent the COVID. So from where we can take the leads? From different preparations as well as different indication. We know for one preparation of Rhaosodhi, so many methods have been mentioned in our text, and all the preparation are different indications. So from those specific indication and preparation, we can take the lead. Pharmacological action and therapeutic indication of Rhaosodhi. Here we sometimes we see that one particular term is given like Bhutagno, but we generally ignore. What is this particular effect Bhutagno? Actually, here Bhutagno, this particular effect indicates that it must be effective over the different organism which we cannot see. So those specific effect we can take as lead. Then adverse effect and management. Again, I am saying that the specific management mentioned in our text regarding to prevent various adverse effects, we can take as lead for treatment of various diseases, like for treatment of Wilson disease, overloading of copper. We can take the drug which are mentioned as management for the adverse effect of copper, tamro. For treatment of iron overloading for the patients of thalassemia, here we can take the lead from the drugs mentioned as management for the adverse effect of low. Lead toxicity. Particularly, it affects the traffic police for the painter. Here we can treat the patient by taking the lead from the management mentioned in our text for the adverse effect of nag. So by this way, we can take leads from various Rasosodhi for different new indications, different new works. So our scholar can take these leads from our text. These are some future prospects of research in Rasastra. We can take some basic research, like studies on controversial drugs, like chapel. Nowadays, we cannot identify one specific chemical entity as chapel. Here, we can take some specific work, specific research work to identify which particular drug can be identified as chapel. Then, advanced characterization, presence of fullerene. We generally claim that our prepared phosmo, those are herbometallic or herbomineral in form. But which specific herbal component are present in the prepared phosmo? We have to prove. Nowadays, we determine presence of carbon in the prepared phosmo, but in which form? Here we can take this specific characterization. The fullerene, the presence of fullerene, it is very easily diagnosed. Now, the standard fullerene, it is available in the market. We can go for simple HPTLC study with the standard fullerene and the prepared phosmo, and by this way we can claim presence of carbon in specific form in our prepared phosmo preparation. Then mode of action at the molecular level. In this particular, in this regard, some work nowadays have been, it is going on, specifically Shorno Bhosmo, effect of Tamro Bhosmo, those are already reported that it is particularly effective in which particular cytokine level it is effective to improve the level of TNF alpha, IL-6, like that. So most studies we have to take in this regard to explain the specific mode of action of the Rasosodhi, how it acts. Then some applied research, application of nanoparticles. As I told that we can separate the nanoparticle of particular shape and size, and then the separated nanoparticles we can apply it as drug. Those will have a particular effect. Search for new application. This is very particular time for searching some specific remedy to treat COVID from the Rasosodhi for new application. So we may go for search for new application of Rasosodhi. Here just I have given one diagrammatic form in which we can apply the Rasosodhi further. The Rasosodhi, those are prepared by taking the metal and mineral ion. Those are processed by using some natural sources, like during giving bhavna, we use some sorosor kath of the drug. Then we do the green synthesis and get the biologically produced nanoparticles. And nowadays we use only this nanoparticle for therapeutic purposes only. Yes, for treatment of diseases. But at the same time, we can use those prepared nanoparticles, those prepared Bhosmo for drug delivery. It is mentioned in our text. Jogobahi effect, it is mentioned as one of the pharmacological effect of almost all the Bhosmo. What is the Jogobahi effect? It is nothing but carrying out the particular drug to its specific site of action. So we can use the Rasosodhi for drug delivery, for the diagnosis purposes also. for differential diagnosis, we can use different types of nanoparticles, different type of phosphoprecursors. And the therapeutic uses, nowadays we are carried out mostly. We are carrying on by taking this also. So these are some future aspects. In a particular direction we can go. So these are some trends, and I may submit here that we may go in particular direction for further research on Rosodi. These are some trend we can take the research on Rosodi in the next level if we go in this way. So thank you all. If you have any question, then you may ask.
Thank you so much, sir. So there is a question in the chat box, sir. Sir, how diagnosis can be done with Rasaushadis? Kindly give examples, sir.
Yeah. Actually, here diagnosis means differential diagnosis. For a particular disease, we may choose different type of bhasma preparation, and we can prescribe those bhasma preparation. In that particular disease, one particular bhasma will act, one don't, and by this way we can diagnose that by observing the effect of those particular bhasma, which particular disease occurs.
Thank you so much, sir. Delegates can post their questions in the chat box, or you can raise your hand so that you can directly ask sir your queries. Delegates, please post your queries in the chat box. Delegates, please note, you can post your questions in the chat box, or you can raise your hand so that you can directly ask sir your queries. Thank you, sir. It seems that there are no more questions, sir. Yes, sir, there is another question, sir. Sorry. Sir, what is the use of Shilajit in diabetes and stolia dose and duration, sir?
Okay. Shuddha Shilajatu, the dose of Shuddha Shilajatu is 1 to 8 Rati, as it is mentioned in our text, means 125 milligram to 1 gram. Nowadays, Shuddha Shilajatu, it is prescribed in 500 milligram twice a day, means 1 gram can be given per day.
Thank you so much, sir. So there is another question, sir.
Okay,
so how
okay.
to fight?
Yeah, how to fight toxic effects of a raw sodium longer use. Yeah. Actually, there are specific dose and duration of raw sodium. It should not be used for a longer duration. Then it may cause adverse effect, and the adverse effect of those raw sodium, those are mentioned in our text. For example, low bhasma. If it is given longer duration, then it may cause Mondagni and others. Then we may prescribe Aragbad Birechon by Aragbad Phalomajja or Ella Churno. If any particular adverse effect, if it is due to gandhak, then it may be treated by excess of cow milk, ghee, or by morichurno. So in our text, the adverse, what will be the possible adverse effect and what will be its management, it is mentioned. And here one beauty is there that, for example, Nag Bhasmo. Nag Bhasmo, it is used for the treatment of Promeho, but Nag Bhasmo is used irrationally, then it may cause Promeho. So it particularly affect in a particular system, the effect may be good or bad. If you use it rationally, then it shows good effect. It will be effective for the treatment of diabetes mellitus. But if it is used irrationally, if it is not prepared properly, then it may show the bad effect. Then it may cause the Promeho. So it is the beauty of our science.
Thank you, sir. There is another question, sir. So how can we identify Ashta Samskarita Parada and Shuddha Parada?
By only observing it, it is very difficult to identify. But if we go for the analysis, you know, by the Shodhana Parad, we don't transform the mercury to 100% pure mercury. Generally, from the market, we can get 99.9% pure mercury. But when we do the Shodhan procedure, when we do the Sanskar, we generally reduce the purity of mercury. For example, after Shodhan of mercury, the purity of mercury, it is reduced 96%. But at the same time, so we improve its biological effect. So only by observing, we cannot recognize which is the pure mercury and which is the sanskarit mercury.
Thank you so much, sir. So there is another question, sir. Sir, what is the use of Rasomatadileba and indication, sir?
Sorry?
So what is the use of Rasomatadileba and indication, sir?
Sorry.
Sir,
it is Rasottamadilebam.
Oh, sorry, sir.
What is the specific reference of this preparation?
Sir, it is Rasottamadilebam in the Kushta Prakaranam, it is explained, sir.
Okay. I don't use this specific, so I have no idea.
Okay. Actually, this is like Kushta Prakarana, it is explained. It is widely used in Kerala practices, in the South India practices, sir.
Okay.
So for students, it is used for the Kushta. It is a very good effective therapy in Kushta management. When it is a hard skin layer, there it can be used.
Okay. Thank you very much. Yeah,
thank you, sir.
For treatment of Kushta, one very important preparation is Rasakorpur. Rasakorpur, only 0.1% solution. It is effective in almost all the skin diseases. Its beauty is it is effective in the hypopigmentation as well as in the hyperpigmentation, in both the cases. The preparation is a little bit difficult, but very effective medicine, Rasakorpur.
So thank you so much, sir. So there is another question, sir. Sir, I have read somewhere that Shilajit acts as glucocorticoid. Then how can it be given, sir?
Sorry?
Sir, they have read somewhere that Shilajit can act as glucocorticoids. Then how can it be given, sir?
Shilajit is nothing but it has more organic content than inorganic. It is actually one biomass. It has some organic acid like hippuric acid and others. and it has very good anti-diabetic effect. All the studies on Shilajyoti reported its very good effect on the patients of diabetic mellitus, as well as pharmacological studies on diabetes. It is a very effective drug to regulate the blood glucose level.
Thank you so much, sir. So they have asked the dosage of Swarna Basma, sir.
Swarna Bhasma?
Yes, sir.
Okay. Yeah, nowadays it is prescribed in 30 milligram twice a day dose.
Thank you so much, sir.
30 to 60 milligram twice a day.
Thank you, sir. So there is another query, sir. In case of any kidney diseases, which is the safe Rasaushadhi, sir?
Yeah, but in kidney disease, modern science, it is written that mercury it is heavy metal, and it may deposit in kidney, and it is not safe for kidney. But it is reported for Kajali and for Rasabarpodi, Rasasindur, all the preparation are safe for kidney diseases. So you can use Rosodi safely for the kidney diseases. There is no harm.
Thank you so much, sir. So there is another question, sir. So how can we identify Samaguna Jarita Rasa Nidra? Sorry, sir, maybe the pronunciation is wrong.
Okay, Roshindur, fine. In naked eye, we cannot identify separately Shamagunjarita Raosindur and Shadgunjarita Raosindur. But chemically, by X-ray diffraction analysis, we can identify, because it is already reported that in Shamagunjarita Raosindur, the Hg acid remains in artificial cinnabar form. Red sulfide of mercury, which resembles like artificial cinnabar. But in Shadgun Jarita Rasindur, it remains present as natural cinnabar, which directly mined from the mines. So from the XRD study, we can separately identify the Shamagun Jarita Rasindur and Shadgun Jarita Rasindur.
Thank you so much, sir. Sir, there is another question, sir. Sir, does Rasaushadhis control creatine levels, and can it be used in kidney failure?
Again, shape question from the same person. Yes, you can. Yeah, as I told you, can definitely use Rasaushadhis for the kidney diseases, for in high creatine level, high creatine as well as high urea level. There is no harm. Just don't go for its modern explanation. No need. Actually, modern medicine, they till date they cannot recognize the HGS as therapeutic entity. But we use Rasindu, Rasaparpati. So we can use safely the Rosudi for the treatment of kidney diseases. No harm is there.
Thank you so much, sir. Thank you so much, sir. I don't think there are any other questions, sir. So shall we move on to the vote of thanks, sir? Thank you so much, sir. It was really an amazing session, sir. Thank you for patiently answering all the questions.
Thank you all for patience hearing, and I am thankful for the organizer for giving me the chance to interact with you. Thank you very much.
Thank you so much, sir.
Now, I would like to invite Dr. Raghavendra, Associate Professor, Department of Kaya Chikitsa, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Good evening, everyone. On behalf of Ayurveda College, Coimbatore and Team DIKSHA, it is my privilege and a great joy for me to extend a vote of thanks for today's session. First of all, I would like to express my sincere gratitude to Dr. Kumar Sarkar, sir, for sharing your valuable experience in Rasha Shastra practice, which is really a need of the hour. Thank you very much, sir. I extend my sincere gratitude to the whole Diksha team for providing us with the best virtual platform. Last but not the least, let me thank all our delegates who have responded so well to our invitation and made it a grand success. We look forward to welcome you again in our coming sessions. Thank you, one and all.
Thank you, sir.
Thank you so much, sir. With that, we have come to an end of today's session. To know all about our further updates, please do stay connected with us in our social media platforms. Once again, thank you, sir. Thank you all the participants for joining us today and hope to see you all in the upcoming sessions. Until then, stay home, stay safe. Thank you all. A very good night to everyone.